When David Butts' water filter is off and he turns on a tap in his modest house in Industry, Pennsylvania, black water streams out. The 56-year-old retired home contractor is angry that he must spend around $50 a month on filters to clean his drinking water. And he worries that before he began using filters 5 years ago, the dirty water was threatening the health of his ailing elderly mother, who lives with him in this rural community. In low doses, manganese is essential for good health. But in high concentrations, it becomes toxic and could cause neurological harm, including tremors and hearing loss, reports the Office of Dietary Supplements, part of the National Institute of Health. Manganese in drinking water may be especially harmful to infants and children, various studies suggest. It is linked to lower IQ and behavioral problems like attention deficit hyperactivity disorder. Don't tell me this water is clean, David Butts says. How many people are getting sick when the water authority could have been doing something? In Pennsylvania rules, drinking water providers must limit manganese to 50 micrograms per liter or below, but they don't have to test for the metal, so it can go undetected. The EPA and many other states and communities don't set legal limits on manganese in drinking water. The EPA is considering whether manganese needs tighter guidelines or legal limits, but its efforts have met stiff resistance from industries that use manganese in their products or produce manganese as waste. A search of federal records, some obtained through Freedom of Information Act requests, show that corporate groups have repeatedly lobbied the federal government to delay or derail regulation. Some of these groups and companies have also hired scientific consulting firms to produce reports on manganese health risks that suggest stricter controls on manganese are not needed and that children are not more vulnerable to excess manganese than adults. As evidence of risk grows, the EPA has taken steps that could lead to tighter controls of manganese in drinking water. It has added the metal 3 times to its contaminant candidate list, but industry has fought back. Last year, Joseph Green, a lawyer for a manganese industry group, called for the EPA to remove the metal from its proposed contaminant list. He said the EPA's Science Advisory Board should consider models funded by industry that say manganese won't build up in children's brain tissue. A consulting firm scientist on the board also made that case. In late 2022, the EPA decided to keep manganese on its final contaminant list. The agency will decide by 2026 whether manganese or other contaminants need tighter controls or guidelines for consumption. Meanwhile, in Industry, Pennsylvania, the state and water authority are working to test the tap water more often, clean the wells, and install a new treatment system. Butts says he'll keep pushing until he sees results. He and other residents want the authority to determine the causes of the black water problem and assess whether industry's children are at risk of neurological harm. Is our water safe? Butts asked. We don't know. Read the full story at publichealthwatch.org.